My name is Conn. This is my comprehensive diabetic foot exam. The patient that I'm examining is a 65-year-old female who has a previous diagnosis of CHF and atrial fibrillation and hypertension. She does not have diabetes, but we'll go ahead and do a diabetic foot exam on her. First thing I do is I would look at her shoes, look for proper wear, even wear on the bottoms of the shoes. I'd look for the proper fit and size of the shoe, and improper fit could lead to rubbing inside the shoe, which could cause ultimately lead to calluses and also later ulcerations. I'd also educate the patient on checking the shoe inside the shoes, looking for any debris or any foreign objects within the shoe before they put their foot into it. So let's begin. I'd start with general inspection of the foot. I would look for unequal hair distribution or any shiny skin that could indicate a peripheral vascular disease, which would be a risk factor for ulcerations. And in this patient, it's not present. I'd look at the toenails, and looking at the toenails should be cut straight across. And I'd look for any ingrown toenails or any thickened or discolored areas on the nail that could indicate fungus. Next I check for capillary refill time, and the color should come back within 3 seconds. Anything longer could indicate circulation problems. Next I'd look for any deformities, which would include hammer toe, clubbing, calluses, Charcot foot, which are the arch of the foot is bowed downward. I'd look between the toes for any fungus, which would be most likely be tinea pedis. And I'd look for any edema, which in this patient there is actually edema present. And it is a +1 pitting edema on both feet, which is consistent with the congestive heart failure diagnosis. The next thing I would do is look for check the pulses of the foot, and check the dorsalis pedis and the posterior tibialis. And on this patient, they're all 2+. Anything or decreased or absent pulses could indicate a thrombus. I'd check for the temperature of the foot, looking for any warm spots or any cold spots. Warm spots can indicate the presence of infection. I'd check for muscle strength of the foot. So I'd ask the patient to push up as high as you can go against my foot, my hand. Both push up, push down, push in, push out. Okay, and it is equal on both sides. I'd check if the patient was not able to pull their foot all the way up. I would suspect a tight heel cord, and then I'd also check the placement of the metatarsals and looking for any metatarsals that are dropped, which could indicate a plantar flex deformity. Next I do the protective sensation testing, and I'd use my monofilament to test that. And I would explain or let the patient feel how it's going to feel, and I would ask them to close their eyes and tell me when they feel it. And check the toe, big toe.
Yes. 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 Yes.
And I did that on both feet.
Yes. 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 Yes.
Okay. So the present does not indicate neuropathy with that test. And next check the sharp and dull, which is also checking for neuropathy. This is dull. This is sharp. And I go over the same places.
Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Uh-oh. Sharp.
And there's no neuropathy present with this patient. Next, I'd use the tuning fork to check for vibration sense.
Yeah. Yes. 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 Yes.
And I'd also check the bony prominence.
Yes. Yes.
Okay. All right. No neuropathy is present. The vibration sense is actually the first is the early warning or early stages of neuropathy if they don't feel that. Next, I'd check the Achilles tendon reflex. Okay, and I'm actually not going to check this foot because she had a knee replacement and her knee is hurting today. So, but I would if she was actually a patient and not a kind volunteer who gave her consent to do this. So then I would move over to, that would conclude the inspection part of the, part of the exam. Next I do the education part. I would tell the patient to use a mirror to inspect the bottoms of the feet, especially if the flexibility does not allow her to do so, and that needs to be done daily. No open-toed shoes, which will reduce the likelihood of any injuries to the toes, which could ultimately lead to ulcerations. I stress the importance of any follow-up appointments. Neuropathy, with no neuropathy, there would be every year. Neuropathy present every 6 months. Neuropathy with a deformity or circulation problems every 3 months. Previous amputations or ulcerations would be every 2 months. Thank you very much, and that's the exam.